Morning, Elliot.
Let's call
Is
our
Karen over
commissioner.
here, or are you running the meeting?
I'm over here.
On there.
Hello.
Hi,
She's on Zoom, and so is Ann Smith.
hello, Mr. Cisco.
Good morning, how are you?
I'm good, thank you.
Good.
Yeah, unfortunately, we're
I only introduce myself that way.
I'm trying to.
Don't matter who I meet, whether it's
You should be able to gallery view
the AG or whatever, I just say, I'm Gino.
there. And she has her camera off, so that's.
It's like
fine.
having a,
I like to be able to see them.
problem is it makes it very difficult for the people who are watching individuals in the room on the Zoom, on the YouTube video.
I don't know why it's
Oh,
not.
really?
Yeah, very difficult.
So when we have it in that mode,
That's how it
Oh,
recorded.
so.
Yeah.
Morning.
Good morning. That's why I would prefer,
Okay.
It's 9 o'clock.
we have all five.
David-
Mr.
David's-
Letman.
Morning. But it's 5 o'clock somewhere.
David's always under the bell.
Time to drink.
Can you guys hear me?
That's about as country music as it comes.
You can't hear me?
Yes,
Well,
we can.
We can't.
Oh,
It's just
Low,
not,
yeah.
it's not loud enough.
Have to
Oh, that's
turn the
weird.
volume up some more on the TV.
yeah. I think it's probably on your guys' end.
I think it's all the way up.
It's all the way up.
Oh.
Is the volume up on your computer?
Let's see if
If you exit full screen for a minute, you should be able to do your computer volume setting.
Is Dr. Reedy gonna be here?
He's here.
So more, I'm gonna reapply them. Is
that's
that,
probably it. There we go.
yeah, I'll reapply.
Okay, is that better?
It's a little bit better. Yep.
Yep.
Go all the way.
Better?
Yep, that's better.
All right, good.
Just a little.
Just a little?
You're
Yeah.
dealing with old people here. We don't see or hear.
Not David.
You're not old, Ann. You can't call it
Or
that.
George, or Mason.
So sorry.
They're all well
Mason.
underfed.
All right. I'm going to call the meeting to order, as much fun as we're having. We've got a lot to get through today. So
Yeah,
call
those
the
are- that's
meeting
a
to
packet.
order.
Oh, good.
If anybody wants to pack it, I have a couple extras.
Folks, hey,
I just.
can you guys hear me?
All I need is financial.
Yeah,
It's all in there.
we can hear you.
So I
Well, okay.
I had to change the ink cartridge twice this week.
All right. Calling the meeting to order. Hello.
Can't hear you.
Karen's asking to call the meeting to order.
Oh.
If you-
so-
if-
All right, meeting is in order.
Okay.
Thank you. All right. Any changes to the agenda? Okay, hearing none. Any changes to the April 8th, 2022 meeting minutes?
I have a point of discussion on the minutes,
Okay,
and that is where it says that Charlie said we have a net loss of $236,000, right? What have we decided the word we're going to use instead of loss? Because we're not a profit and loss making organization.
Deficit.
Okay, so we're going to use the word deficit going forward? Are we?
Are you asking to change that in the minutes before we approve them?
Well, because we had a discussion on it last time.
Right, I just want to clarify.
Yeah, yeah, I think that would be good. Just that one word.
The QuickBooks reports will always say loss. So throw that out there, but, and anything that I produce, I'll certainly use the word deficit.
Okay, so then we'll just substitute the word deficit for loss in that one spot. Can I make a motion?
is that agreed upon? Yep, that's fine with me.
I don't think you have to make a motion.
Okay,
Yeah, we can just make that change.
all right, then I make a motion to approve as amended.
I second.
All those in favor?
Aye.
Aye. Anybody opposed? I don't think so. The minutes have passed. Before we open it up for public comment, I don't know if we have anybody signed up, but I just wanted to let you folks know that
We can hear you.
What? Oh, you can hear me. Yay. Okay, good. But if my Wi-Fi kicks out or something like that, I apologize. I'm on work travel. It was a nice couple of years of no travel for work, but if I kick out or something like that, I deferred obviously the vice chair and Wynn to continue on the meeting, and I'll reconnect as possible, but we still have a quorum. Even if for some reason I accidentally drop off with Wi-Fi. So just wanted to state that. Is that all right with you, Ann?
Yes.
Thank you. All right. Anybody have any public comment? Or we have anybody lined up for public comment? We're good? Gino,
Nope.
thumbs up?
No.
Okay.
Yeah. Very small group
All right.
today.
Very
Just
good.
core.
Okay.
We don't even have.
Thank
Caleb
you.
today. You're welcome.
All right, we're going to go on to unfinished. You can tell I want us to get make sure we have maximum time on the budget discussion. So I'm just kind of trying to quickly get through the agenda here. Defer Gino update on vacancies.
So I did hire a new nurse director. She's super qualified. She is finishing up her PhD right now at Shenandoah, or a master's, sorry, yes, master's. And she'll be available full-time in May, but she'll be off and on, part-time and full-time over the course of the next 11 months. And like I said, she's amazing. So I hope she works out great and you can hold on to her. And I know that Gillian has put out to hire a new sanitarian. That will be a food inspector.
So, well, yeah, it's for the retail food program grants is that position. And I had to re-advertise it because we didn't get any qualified applicants in the first round of advertising. There were only a few applicants and none were well qualified. So I re-advertised it. That advertisement ended yesterday. So I should be getting a new preferred list hopefully within the next week or two.
What's the qualification? Do they have? They need to have.
They do need a bachelor's degree. In order to really move forward in the profession, the bachelor's degree should have a good amount of credit hours in science related courses. So they should have a strong science background. But that's pretty much it. So as far as
Biology, physics.
Right. Right.
The second one or third one there is an office assistant. We internally posted that. There might be someone who's currently on staff that transfers into that position. I've not had an answer from that individual yet, whether they're interested in taking that position from the current position. If they do not, if that individual does not take that position, then we will open that position up to broader, to regular DOP hiring system. So as opposed to being internal, we go external also. And then the social worker is something I put up on the DOP. And Dr. Reedy can speak to that a little bit better than I can.
So this will be a person primarily hired for the substance use related quick response team grant. And that's waiting for the division of personnel processing till we can post. Has to be posted internally to employees of the state before we can post it to the public. Or people can know about it, we just can't accept their applications yet.
So this is from the harm reduction grant.
It's actually a quick response team grant, and it's the same ball of wax.
similar but not the same, because if it's harm reduction, then the definition is different.
Yeah, there's special definitions of all these things in the state language.
That's it on the unfinished business
And
here.
we are bringing on board several community health workers for the COVID health disparities grant. So we're bringing them on board. They will be part-time temporary people for the next year.
All right, thank you. Any questions from the board? All right, we'll move on to Charlie with your update and the review of the financial reports.
All right, good morning, everyone. You received two board packets, the March 2020 financial packet and then the April 2022 preliminary financial packet. To review March real quick, as of March 31st, we had a cash balance of about $333,000. For the month, we had a deficit of about $36,000. Year to date, we had a total deficit of $271,000. April, things started to pick up. We have a cash balance of $537,000. For the month of April, we saw a surplus of $237,000. That brings our year-to-date deficit to $34,000. Overall, as of end of April, we are above our targeted income by 20%. There are several factors. We received the NEHA grant of $76,000. We received our reimbursement for the retention incentive, $61,000, and then we saw that big increase in permits that we had been expecting. As far as the fees for permits, as of last month, we had $96,000 for the year, and that was about 35% of our budget, I believe. As of the end of April, we had $235,000. That's 94% of our budgeted amount for permit fees for permits. Total salaries and wages, excluding the incentive pay, we are above budget by 5%. That's been pretty consistent the last few months. Total operating expenses are below budget by 6%. Any questions?
No questions? Okay. All right, is there a motion to accept the financials?
Charlie, do you have something to say?
Oh.
There are also the key metrics you guys wanted. I did forget to go over that. Would you like to discuss it? So the reserve requirements, we are in compliance with the reserve requirements. We're above the target by $225,000. Accounts receivable sits at about $161,000. Average days to pay is about 27 days. But out of the $161,000 receivable balance, we're still waiting for about $100,000 from the state of West Virginia. And that's 62% of that balance. And as far as I know, there's nothing significant happening in May so far to report.
Business as usual.
Okay.
It just sounds like that's a relief that we're starting to catch up.
And we just had a delay in the permit income. It usually starts to pick up in March, and we didn't see that until April this year.
Charlie, on the P cards,
Cards?
yeah, P cards, is there a kickback that is received, or usually P cards have rewards points and credit cards? So where is that, where do we see that in the report?
The
What percentage of
rewards
It's supposed to be 1%.
is probably recorded with interest income, but I'd have to look into it.
Are there more expenses that can be paid on a P card that instead of checks, we could get more?
Yeah, I can
of that?
see it. I'm not sure what's being paid with P card versus check, but we can look into it.
You look at that and see
Yeah.
if we can get another 1% back on who knows how much.
Yeah, it's right here.
Well, I mean, it says we only put $9,000 on.
We got a 773 P card rebate, if that's what you're looking for specific. However, I will address that. Yes, that is happening. It's occurring with multiple different things that we're moving stuff away from paper checks to either P card or some type of direct reimbursement from the account. That's what
The more we could put on P cards, the
Totally
better
agree.
off it is.
Absolutely, and that's already begun happening. We've moved several of them from paper checks to, and what I'm hoping is that Ann and Karen both, who do sign off on the checks, will notice that there's an appreciable decrease in the number of checks that need to be signed and goes onto either the P card or some type of direct deposit off of our account,
Right, is
when allowed.
Is there an approval process for the P cards?
Yes, it's through the state.
If everyone, well, Karen, or whoever, if there's two people
Not necessarily, because that's actually done and approved at the state level. P cards are issued through the state and they're approved through the state. And they're quite. Yeah, I would hope so too. Maybe that's like one of the few places they're tight.
I don't have any other questions.
That's a good one.
Anyone else with any questions? And if not, is there a motion to accept the financials for March?
So moved. I make a motion to accept March's financials.
Second.
All right, all those in favor say aye.
Aye.
Do I hear ayes?
Yes.
Those opposed? All right, the motion passes. All righty. Well, I don't know if we have any further conversation on the cash reserve.
We do.
Gino, okay.
And the reason is as I get deeper and deeper and deeper into my position, I found that there is actually a code, West Virginia Code 64-7.
Aye.
8.3. The board should maintain a cash reserve equal to at least the past 3 months operating expenditures of the local health department. So I ran the numbers on that. Currently, that would equal $328,436. That's the rule that's in place for local health departments by the state.
Repeat that, 300.
Yeah, what's the number?
$1,436. That should be that should be the cash reserve based upon the rule extended to local health departments by the state.
So that is, how many percent is that again? I'm so sorry.
It's 3 months of the operating expenditures of the previous 3 months.
90 days cash.
90, exactly.
I thought it was in the 300.
328.
Sent some original suggestions.
That's exactly right. And that was mine. Was that I think that's more accurate than doing an average of the previous fiscal year, and then because things could be growing in the past 3, 4, 5 months, and it doesn't take that into account. So costs could be going up.
All right, so
This is much more current.
are we there right
Yeah,
now?
we're still in compliance.
The last one, we were barely in compliance.
Yeah, last month we were barely, but now with the influx of cash, we're
You got
we're
close.
comfortable.
Yeah,
Now we're comfortable.
I suspect there's no enforcement mechanism in the code.
Well, I'm sure there isn't, but that doesn't mean we don't do the right thing, correct?
Absolutely.
And that's the rule, so that takes that off the board if it's not something you would want to move to change, or, so the rule, the way that works is we have to be at least as strict as the rule. Doesn't mean we can't be more strict if you guys would insist upon it, so that's up to you. Maybe something that you think about and move on and move
So the
to,
whole code.
I don't have the whole code, exactly, yep.
That's all right.
No, not at all.
Charlie,
So it's one of your cash reserves.
Do I read it correctly? Our bank balance as of now, give or take, is 333,000.
That was last month.
That was last month. Okay. April.
She said it 537.
It's also on the agenda.
328, 436.
Was the cash
So
balance.
500 something right now.
That's the bank balance, and then I think our reserve amounts at 311,500. Is that right?
Yeah, so I have bank balance at 536, reserve amount 311. So we're in a surplus of the reserve requirements of 225.
But the number by code that Gino just said, we should be at, was it 328?
$17,000 more, correct, yes.
Correct. But we're still in compliance with that comfortably.
What was the,
That we keep the money in, do they earn interest?
No, I don't believe so. That's a great question.
And I
I think
can,
we'd have to put it into a savings account, not into like a checking account or something like that. I don't know what I'm not up on that type of business.
Well, I'm the treasurer of an organization where we keep money in the money market when we transfer it into checking to.
And that's what I do with my private accounts.
Yeah.
I think there's actually something in the code about what bank we have to use.
Oh, really?
We have to collaborate with the county commission and use their banking system, so we'll have to.
Something we'll have to ask.
Yeah,
I'd
it's
have to
actually
ask
written
the
into one of
finance,
the rules.
the county
Okay.
finance director on that and find out if that's something that we could earn any type of interest on.
For the future, I will update the key metrics to reflect the West Virginia code.
Please.
And I guess the one question I have for you right now, within the calculation of the board approved in the past, you have a $50,000 buffer. Should I get rid of that and just do the 3 months prior operating expenses in the calculation, or would you also like a buffer in there?
I think we should follow code.
I think we should follow through too.
If
That's
we
something
could maybe put that in a motion, because there's a question about whether we have a rule
Right,
about that.
right. I think it's something that may require a little bit of research, and I don't know that this rule was referenced in the old rule that was passed a few years back. I'd have to ask the previous administrator and see what she has to say about that.
Would you like?
But it's, well, wait 1 sec. If it is in code, is the rule then, is the potential motion or potential motion to undo the previous rule? Because if it's already in code, it's in code and we have to be compliant regardless.
But we are allowed to be more strict, but that rule was also different than this rule. So that rule was, it was an average of the previous fiscal year's operating expenses on a monthly basis times 3 plus a $50,000 buffer. So it's different, actually different than the rule. So in a way, I don't know how parliamentary way, what the parliamentary route is to enforce the current code, state code.
Well, the rule already seems to have taken into account the code requirement.
It's a much different formula though.
But it's the requirement in the code plus 50K.
It's not the requirement in the code.
It's a different requirement.
We're talking about the previous years at an average of operating
okay.
expenses.
Okay.
I think this is partly, if not largely, an accounting question. And so I would just suggest that we don't do anything until we get our either a finance director or one of the accountants to review that issue, and I'd be happy to work through it with them. But
So you're saying, Nathan, that we should stay with the state code rule, the state rule?
well, I'm saying we have to make sure what the entirety of the rule is. I have the rule in front of me here, and that makes sense, although that number, it says at least.
Right.
So I agree with you, you could have more, but that number would also change based on the past 3 months finances, or it could change.
Absolutely.
So I would think it would be prudent to have some sort of buffer in there just in case it does change going up, you would still be in compliance. However, I think it's kind of an accounting question, and I think we ought to explore it with them. And I agree with you. I think we have to run it, through the county commission's financial system as well. So
My concern with the buffer is that when we do like we were last month, is that we've got arrears of payments catching up, is that we could get into this buffer zone, and then we would be required, if it's a rule, to cut back on staff or some other thing that we needed. And I think having that buffer is what I would call a yellow light. We would slow down and do something else. We need a warning, but if it's a red light, we have to stop it, something to reduce. It's just my concern operational.
If you want to incorporate in the rule, then you would say, if you cut into the buffer, you have 90 days to get it back to the balance. There's a lot of ways to make it more flexible. But that's a good point.
I don't think anybody on the board wants to fire or try to plug the budget before we get to it. I personally think the local rule should say that we need all stakeholders.
let's wait until we get a,
Nathan,
yeah, let's wait till we get an answer from the finance director of the county. I think that's probably the best way to go.
I actually think everybody's thinking about it anyway, so. If we follow the state code, Charlie just affirmed this, we had a couple really expensive months. This fourth subsequent month would create a high cash reserve. If you run off of the local rule, it's average, that's less likely to happen. So the local rule is more likely to produce a lower cash reserve than the state code. You agree or disagree? Okay. Okay, so my concern would be that local rule should be less than the state code. I don't think we're gonna have an incidence where the state code is gonna, the local rule is gonna make the number be higher than the state code. It's actually all less.
Right.
I
And
think
it says at least in the rule.
yeah, I think at the time that local rule was adopted, they were aware of the state code, which is why that.
It's, the code is probably also cash reserve.
And also, I think more accurate one to current expenses. I agree. So that's something to put on the agenda for next time, just have a vote and say, what we want to do.
If you want to be more
I'll
strict.
make sure that gets on the agenda for
Reserve
next
not having a buffer.
Yeah.
That'll be an operation.
that, make sure that gets on the
And,
agenda for next month.
just so everybody's aware, any change to the local rule has to also be approved by the county.
Yes.
commission. So they will have to vote on it after you vote on it.
I think we need to vote some back up if you're in the state rule.
I mean, I don't think it would be.
Absolutely.
Good job in doing that research.
Doing the best, trying to find things. Trying to find things that make the job easier and better here.
All right, well, thank you. Gina, do you want to just go right into the budget report? Basically, everyone, we sort of set up the agenda since I think all of these different pieces all impact the ultimate budget decisions we make today. The increased state aid, the discussion about the Airbnb fees. So that's why we sort of grouped it this way. So I'm going to turn it over to Gino to kind of run through that sort of holistic outlook on the budget, and then we can obviously dive into any questions on the budget for next year, and then hopefully be comfortable in a place to vote on it.
I'm sure that everybody got my email and I had some responses, so I'm pretty sure everybody did. So I sent the same budget, same budget that's been floating around the last few months. But I tried to be even a little more open with some of the things, and I also incorporated what Ms. Weldon said about the expected reduction in well and septic permitting. It's definitely a single sheet.
Yeah.
Yep. So any type of budget discussion probably should start with where we receive the primary amount of our operating funds, and that comes from the state. So on May 2nd, I attended a meeting where the new funding formula was discussed. Funding formula is quite complicated. It includes a coefficient that increases state aid based upon factors like poverty rate, life expectancy, population density, and a few other factors. If your coefficient increases, you get increased state aid based upon your population. So everybody gets a base based upon the population, $6.11 per person within your county. And then if you have the coefficient, that $6.11 can go up to $9 or $10 per person, depending on how many of these factors figure into your coefficient. Unfortunately, Jefferson County does not receive a coefficient boost because compared to the rest of the state, we are healthier, wealthier, and less rural. So we get a coefficient of 0.00. So no additional funding for us. Any additional funding is then taken out of the pot for all local health departments and directed to counties who have a higher coefficient than us. So yes, so this, I think everybody who knows this and everybody who lives here in Jefferson and Berkeley counties, they know that these two counties and along with Monongalia County support the rest of the state. So there's really not much to surprise there. So
So we're subsidizing the rural.
you got it. Yep. And you're not surprised.
No, I'm not at all. So what goes into determining the coefficient?
So the number one, 40% of the coefficient is the poverty rate. Took 20% is life expectancy, 20% or 15% is population density. So the more densely populated you are, the less rural you are, you do not get any additional funding. So the more rural you are, the less populated you are, the more money you get.
That's 15%.
Yeah.
And the poverty
Poverty
rate,
rate's 40%. So poverty rate is really the big kicker for the coefficient. We are the wealthiest county in the state. We're not getting any extra money for our poverty
But we already get funded by person.
rate.
per person.
Base, yeah, $6.11 base. We just don't, but all that money comes from the state, comes from this, what additional money is provided for that coefficient, we're not receiving any of that.
Got it.
what makes, do you know what makes up the other additional 25%?
Yeah, there's little itty bitty things like health disparities, like how close you are to a major hospital, things like that, those types of things, other health disparities. And there's a bit of a demographic kicker in there too. What is your average age? More elderly, you get higher rating on your coefficient. The younger counties get less money based upon the coefficient.
We are one of the youngest.
And we are one of the youngest. Yep.
That doesn't surprise me.
Yeah.
Mount Airy is probably the one.
The three big ones are the ones you'd expect. Berkeley, Montague, and Jefferson County. That's what it is.
West Virginia has the oldest demographic for the state.
Correct. And it's, but of that, Jefferson County is not making that much of a contribution, regardless of the age of people in this room.
And that is probably because of the youth leaving.
Yes, and coming here. So I ran the numbers on it, and I looked at the numbers that were given to us from the Deputy Commissioner of Health Improvement, who was on the meeting, and we are going to receive approximately a 13.5% increase, which is actually more than our 8% population growth over the past decade. So we're getting a little extra. So that's an increase from 368,990 in state aid to 419,818. If you want to talk about numbers, 369 to 420. An increase of a little over 50,000 or almost $51,000. And of course, we know that that pays out quarterly. I learned something that I did not know at this meeting. So your quarterly payments that you receive from state aid pay out in 20%, 22%, 25%, and then 33% for Q4. That's how they pay out. So they pay out incrementally larger. And I was actually explaining that because of the way the taxes are collected. They get more, they receive more money towards Q3 and Q4, and that's the reason it's studied out that way.
So why would we have gotten a 5% over the population increase?
It's in
We had a zero coefficient.
correct. Well, there was extra money thrown into the overall budget for across the board with wage increases, salary increases. Okay, so that's part of the increase in the extra increase. And that's something we'll be discussing later also. That also comes into the budget very heavily. Because we all know that personnel costs are the driving force behind any type of expenses in an organization like this.
So I have a quick question. Your quarterly funding, so let's say the first quarter we have 50 people. And then the next quarter we have 70 people in the county. So they're gonna fund it per 70 or they just like flat out?
It's flat out. It's based on the census, which is done every 10 years. So
Wait, we're growing pretty fast.
we are. So we'll have to.
Standard.
It is. Exactly right. Yep, that's exactly right. It's done in arrears. They try to catch up to your population growth after the census. And you'll see that if you look at state funding on the budget here, you see it pretty well flat. So unless they increase the amount per individual in your county, they're not going to give you an increase based upon population growth until it's measured.
But don't you register through the DMV and the school, the children register at school, the population growing, obviously.
You have
And
to
then-
levy the state.
Yes, that would,
It's just in the procedure.
exactly. That would be something that would have to be done at the state legislature. So delegate or senator, we can reach out to them and ask them to do an annual count. That would be wonderful, because us, Berkeley and Montague County, we have to do that.
With the age of computer, I don't see. why
I agree,
we
I
can't do
agree,
that.
but that's, these archaic.
Taking up with them.
Yep, that's the way they've done it for years, and that's the way it'll be, continue to be done.
That
So,
would be next in my agenda.
found the room for state delegate for sure. So the next step on holistic budget is the discussion of the Airbnb fees and the budget impact. I'll turn it over to Gillian. She can address a couple of those things.
So, the Airbnb fees, the state said basically based on the general sanitation regulations, they meet the definition of a motel, which is how we set the fees for them. So the motels with 1 to 20 rooms are, the fee is $125 for the permit. Bed and breakfast permit fees are set at $60. Bed and breakfast, you also have to pay a food establishment fee of $125 every year for their permit. And then all the plan review fees are set in a separate rule, and those are $125. That's a fee for service, plan reviews. And the others are all in the 64 CSR 30 fee for permit rules. If we can change those fees. You guys can do that. You can vote on it to change the fees if you would like to reduce the Airbnb fee. You can do that. It does have to be done the same way all fee changes are done, whether it's an increase or a decrease. So we would have to put it out for public comment for 30 days, vote on it after the public comment, and then if that passes, then I have to also send it into the state. I don't think they're requiring approval from the state anymore, but I think just notification of the state now. And also the county clerk to register the new fees. So it would be that process if you do want to change that fee at all. And we have right now 15 Airbnbs that are permitted. We know that's not all the Airbnbs here, but I don't know, when we'll have others permitted. So right now it's 15.
Question. You say the permit, the annual permitting cost for hotels is
Yes,
Up
well,
to
for 0 to 20 rooms,
$100.
it goes up if you have more.
Is that the same rate as for a hotel?
Hotel would be with 0 to 20 rooms would be $125 annual permit.
All right, so,
And that's just for the hotel permit.
yeah, most Airbnbs are flexible.
Right.
And
That's just what they're classified as, because they can't be called a bed and breakfast in that, because they're not bed and breakfast and somebody doesn't live there. Those are the two things that differentiate a bed and breakfast between a short-term rental, including Airbnb.
Well, that was actually up to that question. You say a bed and breakfast is $125 for the permit or
$60.
$60?
$60 for the bed and breakfast permit, but they do also have food establishment permits because they're serving food, which is $125.
25 for the food. So if a motel has a buffet breakfast in the morning,
Then they are also paying a food establishment permit.
the same hotel.
Yeah.
So I think, I might have heard you wrong, but I'm not sure. You said, so there's application fee for Airbnb, which is
There's
1.5.
So that's for the permit. So
There's a plan review fee also.
it went for new Airbnb, there is a plan review fee of $125. I did waive that for the initial several months when we just found out that Airbnbs were supposed to be permitted. So I did waive that for everybody. So they only paid the $125. They didn't pay $250 to get their Airbnbs permitted when we just found out that they needed to.
So for you and your staff, would it take some more time to issue the permit or the plan?
The plan review. So I mean, the plan review, we're going through everything in that it's a packet that they submit for it. And then if we have any questions about it, we're reaching out to them. And then we go and do the pre-opening inspection before they can get their permit issued. So
Can you
So we're just making sure that everything lines up with the plan review and everything is right. So,
Would it make more sense to permit the Airbnb the same as the bed breakfast, because they're about the same
I
size,
mean,
and just the
that's-
difference is.
I don't have any problems with that if you guys want to change those fees. I'm just letting you know that the process for that. Like, I agree, they're pretty much the same as bed and breakfast in as far as they're a private home, basically, that's being rented out. So yeah, I'm okay with you changing the fees if you want to. Like, I don't really have any issues with that. It makes sense to me too. We just couldn't do that based on the rule definitions, but you can do it, you can vote to do it for, I would call them, if you make a vote, call it short-term rentals, because they're not all Airbnb, that's like the term that commonly used.
And is there, I mean, in an Airbnb, there's a kitchen in the home. The person who's renting is serving food, but there are people that are going to be preparing food.
And that's fine. We don't get involved with that.
So the plan review fee is being waived until when?
That will, we waived it through the end of this fiscal year. So,
So because this is a public forum, and this is on public record, we want everybody to know that the waiving of the permit fee,
for the, not the.
or sorry, the plan review fee
Mhm.
will end at the beginning of the next fiscal year, so July
Yeah, for
1st.
permits that are going through the next fiscal year, so if you're submitting a permit application for next fiscal year right now, we haven't waived that. We could potentially, but we have not. I did.
Is the plan,
Everybody who came into compliance after we found out and tried to notify everybody about that requirement to not have to pay a plan review fee in addition to the permit fee.
so I'm sorry if I missed this, but on the plan review cost, does that apply equally to whether you're renting a room in your house versus renting out a separate residence that you don't reside in? Because I know those are sort of treated differently in code. So, but do you have to have a plan review for both?
Now, if this is your primary residence that you're renting a room in, we are not permitting you. You're not required to be permitted.
Okay,
So
gotcha.
It's only if they're renting rooms or a house in something that is not their primary residence.
Right. Okay.
Nathan, are you still on there?
Say that again.
Nathan's still on.
Oh yeah, Nathan's there.
Yes.
Nathan, do you think we should go to executive session? Because these rules can be in conflict with planning.
Quite frankly, I'm having a little trouble hearing the entire conversation.
I think we should go into executive session. I fear that some of these rules may be in conflict with planning and zoning in the county.
So today's discussion is for Airbnb fees and the budget impact. So if you have
That's
other
definitely
matters to
something to
discuss
bring up.
about it, then we can do that.
The next meeting.
Well, and also one of the things, y'all, is that again, we'd have to go through the 30-day comment period as Gillian had mentioned. So I think for purposes of this conversation, in a potential for us maybe reducing these fees in the next fiscal year, the reason why I wanted to have it in here is that maybe we reduce down the anticipated revenue if we're going to reduce the fees, or give us the ability to reduce the fees in the coming fiscal year, since that's, that action item still requires a 30-day comment period. So that's actually kind of the purpose for the conversation today, is sort of in that holistic budget piece. And quite frankly, based on the numbers Gillian gave us, that there's 15 Airbnbs permitted in the county, if we do potentially go ahead and reduce the fees later on, it's like a $900 difference in the overall budget. And that's a static number. That's not anticipating maybe more Airbnbs will open or whatever the case may be.
So we discussed that, Gillian and I, and if Airbnb permitting goes up and the fee is reduced, that'll only be a net positive on the budget regardless, because we're only,
Right.
we've only budgeted, we've only, so far only done 15, so it would be a net, it would be a net positive regardless, so.
Do we need to give notice that we're discussing changing the fee or reclassifying the Airbnb, let's say, as a bed practice type of thing? Whatever, I mean, for the purpose of the fee.
They won't reclassify it, so for the fees, you can change the fees, but it's not going to reclassify how the state is defining those. So they fit into a definition of a hotel because there's nothing in the general payment station regulation that specifically refers to short-term rentals.
So does the state define what bed practice is?
The state does define what that is. Yeah.
And we can get that for members if you want.
Because I looked at the code, you know, with regard to these things.
Which
The state code,
there's a lot.
there's a lot in it, but it doesn't, I didn't find any of the specific things. I thought I read almost the entire chapter, at least the article. In the chapter.
You mean 64 CFR 30?
Yeah.
That code with the permit fee?
Yeah.
But I didn't know if you were referring to that or the general sanitation regulation.
No,
So the West Virginia codes, the bills that are passed, there are also administrative codes that are,
but they
we have to go into,
rules.
and they're harder to find. They're on the Secretary of State.
Yeah.
website.
Yeah, they attach rules to legislation. That's that. Wow, okay.
Quite the rabbit hole.
My mind's usually swimming at home.
And
Underwater.
that happens almost every day. I understand.
Yeah.
And that's why I rely on Gillian and Dr. Reedy to keep me up to date and make sure I'm not spouting complete falsehoods. You know, I still do it occasionally. So, the next step in that, I think, Karen, if you're okay to move to the next step.
Yep.
Are we going to put it up for public comment or do you want to wait on?
Okay.
Making
We
that
should.
decision before we should?
I think, I mean, my personal opinion, can we go to a slight bit of discussion here?
Yeah.
My personal opinion is that we should stop any actions with Airbnb or short-term rentals. The implications of having white change landscape in the county. There's all kinds of conflict between regulating Airbnbs and planning and zoning. I think we should stop it totally.
That's basically saying we're going to stop following state regulations. because
I'm not gonna argue. I think that's how I feel.
Just like what Ian was saying, the state has their regulations, and their procedures. A lot of the state.
I don't disagree, but I think some of these things are hard. I think it's hard to generate a fee and charge when you're not even sure what aspect.
I know,
of the
now.
operator.
I personally did not want to get involved in permitting Airbnb, but when I find something out from my superiors in the state and they basically tell me you should have been doing this all along, I am always trying to comply with state regulations and requirements, and that's, so when they told me that we should be doing that, I started doing that, so.
Yeah,
You should.
No, I'm not saying you shouldn't. I'm telling you what I feel. And
I understand, I didn't want to get involved in doing it.
hey, and look, even the planning review that you're asked to do, like I've read it and I understand you're doing your job and you're doing what's there, but me reading it, I'm like, my God, we're regulating fire code, which we don't have the
We're
authority
not,
to do.
we actually, no, so basically what we do in our regulations, it does tell us that they have to comply with specific other codes, including the fire code. So we basically, after they are inspected by a fire marshal, that's the check there. We don't actually do
Okay.
anything. We're just checking to make sure that they have had that inspection. However, we were told by the fire marshal that Airbnbs do not need to be inspected by them. So it's not, we're not even looking at that.
Well, here's the sticky wicket here. is if we decide that an Airbnb, for example, deserves a different fee, albeit, lower fee than a bed and breakfast or than a motel, we are de facto reclassifying that establishment as being something other than a motel, even though the state says it's a motel. So that's a question for Nathan. Hello, Nathan.
And the state, I did reach out to Judy Vallandigham, who's the BPH OHS director, and she told me that the board can vote to change fees. And I told her that you were looking at specifically doing it for short-term rentals and Airbnbs. And she didn't imply that there would be a problem with
Okay.
defining it as a short-term rental. She said not to define it as an Airbnb, but
Right.
because that's not, it doesn't encompass really necessarily what we're looking at, because Airbnb is a website basically then.
Right.
So,
Actually, is Airbnb a brand?
It's just like.
It's a brand,
like,
yeah.
It's like saying Xerox.
Ah,
Yeah.
yeah.
Right.
so
I mean,
it's not
Kleenex.
how to
Aspirin.
define them. It's just,
Aspirin.
Yeah, short-term rental.
right.
Aspirin used to be a brand.
So can we put it out for public comment that we're looking to change local rules regarding short-term rentals, and those local rules and the discussion may involve fees, permitting process, and definitions?
Well, you can't change the
We can't
permitting
really,
process.
yeah, we're not,
But we can
not,
change, all we can change is the fee.
yeah, just the fee. This
Okay.
is just for fees. I don't think we can change the definition
Right.
or the permitting process. It would just be the fee.
Right.
By
Does
doing
the
that,
state
we
give you-
have to rename the little section below the motel and hotel, don't we?
So that's a definition.
So for the fees, you mean, for our fees? Yeah, we can.
You can't just
we're-
lump it
Well,
in.
we're not changing 64 CSR 30. We can't do that. That's a
Right.
state regulation. All we would be doing is changing our list in QuickBooks and adding something for short-term rentals in that list. That's a different fee.
We'd have to define.
You still have to
which-
define,
Which establishments fall under that.
Right.
So do we have to put that out for public comment?
Yes.
Okay. So Karen,
that's what we're
Um,
saying.
I make a motion that we put a discussion of the fees for short-term rentals out for public discussion to be voted on at the next meeting.
Are you asking for the opening of the public comment period, or, because I think for the public comment period be triggered, and Nathan, please correct me, is that we have to actually define what it is that we're doing exactly versus just public discussion.
Yeah, I think you're right. So I think on this one, maybe we should look at it, bring it back to the board next time with what we need to, with what really we need to do. At this point, we don't know everything that we need to do about it. So we need to look at what we can change and what we can't. You bring it back to the board and then.
Oh, if it's just this one item, can we vote on it now and that trigger the public comment period?
We can just direct the staff to put together the research on this and craft what it is that we've been discussing for us then to vote on it next time, and thus then open it up for comment period, public comment period, so triggering it.
All right, well, that's fine, but as Gillian said, the only thing we need to discuss is the establishment of the fee for this type of establishment, because that's the only thing we have.
But I think, I thought I heard that we also have some questions over, we have to define something, so we want to make sure we're compliant with the statute, correct? And so
Well, the statute
that's
is
what I was
great.
hearing.
The statute has already defined a short-term rental that we've been colloquially calling an Airbnb.
Mm-hmm.
Our statute doesn't define a short-term rental per se, however, but based on what they are, the OHS department determined that they need a definition of a motel in our general sanitation
Right. So
regulations.
the state has determined that an Airbnb, which is a short-term rental, classifies as a motel. So we've been charging them $125 for the permit annually. The only question open for discussion is whether to reduce that fee or keep it the same.
Right. but
So-
we still-
So can we vote on that now and decide what we want to do? Or just put it on the agenda for next time to vote on, and then that will trigger the public?
Yeah, I think we should take our due diligence on this to make sure we're straight on our language. Because the thing is, I think, one of the things that's popping into my head, because I'm agreeing with all of you guys on obviously this interest of fee reduction, but do we need to put room numbers in there? Because, does it need to be one, a 1 to 2 room number? Like, I think we just need to have our due diligence in sort of what we're putting out there.
Well,
I would
sure.
just prefer to review it for a bit, and so that we aren't overlooking something.
Right, a
That's all.
short-term rental could be could be a trailer or it could be a mansion. I mean, it's not the number of rooms, it's what you classify
Right.
property as.
If we don't classify, make section like specify the room numbers, then we gonna be inadvertently reduce every motel, right? So
Yeah, so I think we just want to make sure we're straight, right?
That's fine with me. So let's get it on the agenda for next time and do the due diligence.
And so can we please, for the staff, if we can have prepared in advance of next month's meeting, the proposed, sorry, the language that would be, the proposed language that we will need to review, that would then be issued as part of the public comment period. And what,
do we need
is that clear
more?
enough?
Well, tourism is a big deal in our county. It's over a third of the jobs. And so this type of establishment is important, new piece in that industry. And it's causing ripples all over the place. I'm on the board of my HOA, and some of the homes inside the community that's part of the HOA are being rented out as B&Bs or short-term rentals. So, I mean, this is something that's been on the on the horizon, and it's been on the radar screen now for a little while, and it'd be good to deal with it.
Yeah. Okay.
If I can just ask, for the purpose of the next fiscal year budget, you're going conservative on the financial impact, is that right?
We haven't added any potential Airbnb or short-term rental fees or permitting fees or any type of fees into expected revenue in any way. It'll be a net positive if it does arrive. If it doesn't arrive, it will
And a
make no
very
effect.
small net positive.
Yes.
impact.
Right.
We're talking less than 5 figures. So well under $10,000. We estimate, what do you
I'd be
think?
surprised.
We estimate maybe there's 200 Airbnbs in the entire county,
I
something
don't
like
think
that.
there's that many.
And Kelly doesn't even think there's that many.
Right.
No.
So
Okay.
that's just
Okay.
off the cuff. So we're not talking about any type of substantial amount of money.
Won't have a massive impact.
Positive
on the
or a
budget.
negative impact if we reduce the fees. So.
Right, okay.
So that addresses what that particular budget impact would be, which was a great question by Karen. And at what level are we permitting Airbnbs, and would it have a budget impact? And obviously it would have a very tiny budget impact.
Right.
On the next on the agenda, Karen?
Yep, go for it.
Want to go to that? So continued discussion of account reserve, cash reserve. I think we've discussed that. I don't think we don't need to beat that anymore. The final thing, and hopefully the least contentious thing, but you never know, is the across-the-board salary increase that was proposed by the governor and was passed by the state legislature, and that the state legislature then added increased funding to local health departments to be able to provide. So they added the funding. They added a total of $1.5 million for all the local health departments for staff salary increases that would be in line with the state salary increases, which was roughly 5%. Across the board. There was obviously troopers and things like that, and local police some of them received greater than that. So that's why our state aid increased by roughly 13.5% instead of about 8.5% as our increase in population would have ordinarily incurred. So the cost of the salary increase, we estimate to be around $45,000, and I did reflect it in the overall budget. The reason we have to have a vote on this now is because the Division of Personnel requires that the Board of Health approve it first. Then we can send a request in, but here's the kicker. The request has to be submitted by the end of May 13th, Friday, the 13th. Today.
That's today.
Correct.
Today.
Has to be in by 5 p.m. today.
I guess we need to vote on that.
Correct.
Yes.
So either way, it has
I
to be,
didn't bring donuts today. Now I have to think about this.
so it has to be in by the end of the day for it to be effective at the beginning of the coming fiscal year. Also, the DOP, the Division of Personnel, will do all the work. That would take me probably 4 to 5 hours of work to process all of this through the DOP system. So they'll take care of all of it and automatically implement it and take care of all the paperwork for us if it's done by today. If it's not, that's fine. It probably will not be effective until September, in which case the administrator or the appointing authority, myself, would have to process all the paperwork.
So the state's already approved it,
They have,
and they've already provided the funding for it.
correct.
So
But I always want to be completely above board.
I want to make a motion that this board approve that, if that's what you're looking for.
Can you be more specific? This board approves the
The
state
action of the
approved.
state that provide for the salary increases and the funding to pay them.
We accept the increase, right?
Yeah, that we approve of
That's up to you guys.
the director implementing the pay raise, and that's it.
I second.
Or third.
All right, all those in favor, say aye.
Aye.
I think I heard it. Aye. And no one opposed. All right, great.
I don't know what to say. Thank you.
So just,
And I'll continue to make sure that we live within our budget because this does have an impact on it.
Okay.
But we'll continue to make sure that we live within our budget. I think the last couple of months have shown that it's an ebb and flow world when it comes to these types of places,
You
but
needed inflation.
we're getting back well into a good financial position again.
Good. Well, as regard to employees and the pay raise, I mean, I went to the grocery store yesterday.
It's rough.
A 7% inflation, so you're still not really catch up.
No, it's not.
Should we specify that the pay raise is 5%?
Across the board.
For permanent.
For
staff?
permanent full-time and part-time staff, but only permanent. And also, I do want to let you know, if you are not out of your probationary period, you will not be receiving it. So we do have one staff member who will not be receiving it because she's not out of her probationary period. And anybody hired prior to the fiscal year would not be out of the probation period. And then that's the law,
Can we kick it in by September for her?
so you know who it is. Well done. Yes, I'm sure that's something that we could
I
probably
don't-
bring up to
I don't know who
okay.
that is.
Okay. To the Division of Personnel. It's our new, it's our
I'm
new
worried about the
sanitarian.
staff.
It's our new
If she
sanitarian.
works here, she deserves to the raise.
Yeah, I think it's.
But that's the rule. And that's in the law that it has to
But
be
if we can
permanent.
kick it in.
Permanent
after
employees
probation.
beyond their probationary period. So it's possible that I could ask for that going forward,
Yes, please.
an adjustment.
Okay, it is law. So,
It
I mean,
is
you guys
law.
really
It
aren't,
is law.
you guys really aren't getting a pay raise.
No. No, agreed.
2%.
cost of living.
No, it's not, it's a partial cost of increase.
Yeah. So yes, it's great and it's nice and we're happy to be able to provide that to our staff who I think works very hard. But it's not as significant as it could be, of course.
But also know, Gino, that the purpose of this board is not management, you're the management.
Correct.
So we're just oversight.
Yep.
And, making rules and stuff like that. So you're the operations guy.
I think we can live comfortably with this increased salary. And I think Charlie probably would agree with me that we will be able to do that.
Who seconded the motion? I'm sorry.
And,
So do you want to read that?
So what I have written for the motion is Elliott motion that the board approves of the director implementing the pay raise of 5% across the board for permanent staff that is outside of the probationary period. I was just adding.
Well, you're reiterating the code part.
Yes. Is that okay?
That's fine.
We just have to,
We just-
sending to the state, we have to.
We have to
Yeah.
be
Oh, that's
specific,
fine.
So
I would say as legislated by the state.
as legislated by the state.
That's a great way to put it,
Yeah.
Karen. Staff will greatly appreciate that.
No
So
problem.
the last actionable item is, let's get into the nuts and bolts. I know Ann has questions because she sent me questions about the budget.
Me?
Yeah, I think you have questions, don't you? Do you not have questions?
Oh, I have a question today. I didn't email you, did I?
You,
Maybe
you,
the other Ann.
you, I could just tell by in your email that you had questions. The email
I
that
can
you
read the
sent me.
tone, yes.
Yeah, I could tell by the tone that you had questions, and that's what we're here to address.
So obviously the email you sent us is this package right here.
That's
It's
the,
the last year budget, and you base on this package to
yes,
estimate the next year budget.
correct.
So.
But we decided, I think we discussed this in March, that I decided to be a lot more open about any grant-funded positions so that we can have a real discussion about costs that are coming in and out. As we know, sometimes grants don't pay out immediately, and it can be a shock to the bottom line. And
Right.
we want to make sure that you know that this position is being paid, if we do hire this position, it's being paid out by a grant, and that there may be a lag in reimbursement on that type of stuff. And I want to make sure, so that's why I try to be as honest and open as possible with this.
Then that throws the whole reserve formula out of whack.
Yes and no. Yes and no. It's
Yeah.
still, the reserve formula still lays in place. And the reason I think that the previous 3 months is much more accurate is that it then takes into account that there might be slow reimbursements and stuff, and then we need to increase our reserve amount around that.
Yeah.
So when I look at this, your expense gonna be about the same as 2021,
2022. Yeah.
right?
Yep.
So when I read through this, so we're not gonna need to buy more laptop, computer, and cell phone. You have 4 laptop and 4 cell phone here. That was in the last year budget. It's like 7,500 here. We're not gonna need that, right? Or is that in the budget for the next year?
That's in the budget for next year.
You still continue
Well,
buying computer?
possibly. There's possibly. Computers age. The computer that I'm using right now is 5 years old. It's running on 8 gigabytes of RAM. It's very difficult for it to run. So there's always going to be technology costs.
So
going
you're
forward.
planning to replace some
Planning to,
computer?
of course.
So some of these items, you tell me if this is correct in what you put there, are these community health workers and others who will be working in the field and be contacting members of the public and leaving a phone number, call me back if you need. And so we don't want them using their personal cell phones for this because they'll be the same with the, so this is,
Those will be covered by grants.
those will be
And
covered by
that's-
grants.
different.
And that's what Emily has in
And
front of her,
we-
the
It's
grants.
the grants.
She has the DLIBs for the grants.
But
They are
you
specified
continue
in the
buying
grant.
new phone every year?
Not necessarily. These would be phones for our part-time temporary employees who would be field reps for us and working within the parameters of the grant itself. So when you see that DLIB for the grant, that's actually what the grant is willing to pay for.
Right, I understand. This is for last year. So this coming year,
This is actually-
2023, you
This
plan to.
is actually for fiscal year 23. The grant, these are all grants that'll be running through fiscal year 23.
Right.
They were approved in 22, but they actually run through fiscal year 23.
But Dr. Reedy, you signed this in 2021. So
Correct.
we bought 4 computer and 4 phone last year, right?
No.
For 2020?
No. That DLIB, it's called a detailed line item budget. Those are opportunities to spend and to purchase those items that would then be reimbursed by that grant. If it's listed in the grant, it's been approved by the grant managers that we can spend money on those items and then be reimbursed by the grant.
Okay, so to make it easy, so we haven't had these items.
We haven't purchased any of these items
So you
yet.
plan to buy?
We plan to buy them and then submit for reimbursement from the grants. Yes.
Got it.
And that's the reason I sent out the grant stuff. I want you guys to be able to understand how grants work. And so those are approved items,
Right.
items that they're willing to
No,
pay
but
for.
this is on a
confusion is
2021 budget. That's
Yeah,
why
but
I'm
it's
like, you
not
already
coming,
had it. Okay.
it's not coming out of the 258,000 operating expenses. That's part of grant funding.
Correct.
Okay.
So it doesn't come out of our
It,
operating
it,
expense.
it doesn't incur an operating expense or any type of inventory expense or any type of capital expenditure expense, anything like that.
Okay, and then you still planning to have $5,000 of brochure and hand out the next coming year?
Yeah, actually, we're doing a health and wellness fair. We're participating in the health and wellness fair. Where is this going to be?
That's at the Charlestown Farmers Market.
It's at the-
next weekend,
And yeah,
the
and
21st.
And so we have printed up some things for that to make sure we have literature for people and that we interact with the community and those types of things. And a lot of that print expense can be billed to the grant.
Mhm. And this one is a big one that I'm on, well, for COVID, I can understand, but for the next year, media consultant, what is that?
So the, this is entirely paid for by this COVID Health Disparities Grant, which runs through May of next year. We have not yet spent any money on it, but we have just received approval within the past month. And it's basically two ways. It's reaching out to members of these communities to educate them on anything related to COVID. And some of that education is going to be changing. And there are two main methods of reaching out. One is the traditional person-to-person. Talk about the Hispanic community, having Spanish speakers who are members of the community engaging other parts of the community, because the current staff at the health department has little insight into that community. So half of the outreach will be through individuals, the traditional way. The other half will be through essentially social media, using a professional company to do this. This was approved by the grantors to do this. We obviously know how important media, whatever you call it, whether it's radio, print, or social media, how important they are in influencing what people are thinking. We have not been involved in that, but it's an important aspect in public health. Outreach equals marketing when you're talking public health. So half of our budget will be people, and the other half will be, and then the information that they obtain will be our property, and also the state's property. So that in other ventures going forward, we hope to learn a lot. We're on the learning curve of using social media, because we do very little marketing. And one of the things we need to do, as we've talked about, is to increase certainly the clinical services that we're doing, as we're talking about now.
One of the good thing about the COVID, when people call us now, eventually we have to educate the public. But yes.
This particular grant was very, very, not only difficult to get, there was only, 3 counties in the state that received it?
I don't know that.
Very few, so we're very select on this one, and I think it's excellent because, as I think everybody knows, the demographics of Jefferson County are beginning to change, and they will change. Just look across the border at Loudoun County, it was overwhelmingly white, and it's changed, and this county will do the same. And if we don't have connections to the leaders in all these different communities, then we don't have connections to these communities at all. So this is a great first step, I think, being able to identify who the leaders are, who the influencers are, and making sure that we connect with them as best we can, and not only market our services, but also let them know that, and because a lot of communities have resistance to government health. And we want to make sure that they know that they're welcome and that we're here to help them, and we're here to make sure that we reach out to them so that they can come see us. And I think this does a great job of that.
I don't have any more questions.
Anyone else have any other questions related to the proposed 2023 budget? Okay, is there anybody prepared to put a motion forward to accept the 2023 budget?
And
I think she's trying to
Move to
talk, but
accept the 2023 budget.
thank you, Ann. Is there a second?
I'll second.
All those in favor say aye. Aye.
Aye.
Any opposed? Sorry, Ann, I saw your hand move. Is that an opposition or did you just move your hand?
You talking to me?
No, Ann Wynn, sorry.
I think I want to stay out. How do I abstain from voting? Yeah, I still not very clear in certain items in here, and I like to be able to observe it further into like the monthly.
Well, just Ann, a budget is something that is essentially a plan.
It's an estimate, yep.
And it doesn't, it's sometimes the revenues don't match the expectations, and sometimes the expenses don't either.
Right.
So the thing is, though, is that we need a budget to work from.
Mm-hmm.
And it can be changed and amended as we move along, but there's a time limit because the fiscal year, we only have one meeting between now and the end of the fiscal year, which is June 30th. So that's the reason for my vote to accept the budget.
I understand.
So that we have something to work from.
Absolutely.
And there's nothing in there that I see that just sticks out as being, something that's a potential problem. So anyway, that's my 2 cents.
That's good.
Thank you, Elliot.
That's good. I believe you guys will have the vote. How do I put this? I kind of, it's okay I think it's okay to say, I kind of want to put you guys in a hot seat a little bit.
Sure.
So that you can tighten the budget.
Of course.
I'm not here to, try to close you guys down.
No.
So that's my.
And I would love for you to sit in at any time and you and I can sit down and we can go over it.
Yep.
And even on a monthly basis, because if you want to dig in that deep, I'm happy to share it with you.
Absolutely.
It's not as interesting as you might think, but it can be done.
Thank you very much for this.
Yeah, this isn't.
Report, because when I look at this, it doesn't say anything to me. I only see numbers.
That's an honest budget though, and a lot of I've spoken to a lot of the other.
All right, actually, hey Gino,
Sorry,
can I pause you for a second? Because we actually have a motion, we have a vote on the floor. So we have one abstention. Yeah, one abstention. And then David, were you and I?
I'll make a quick comment and then I'll give you, I think I'm satisfied with the budget for the simple fact is that we have some code to make sure that we don't increase the deficit. But I would encourage Gino and the staff to work on increasing the revenue side, the revenue stream. Personnel expenses are going up a lot, which means there's additional personnel, and I think they should be able to go out and produce more revenue. So I'd like to see the estimates increase over time, but that's my comment, and it's an aye.
I'd like to surpass revenue.
Thank you.
The revenue needs.
So the motion passes 4-1. Thanks, everybody. Obviously free to open to any follow-up discussion now if you'd like.
Yeah, wait, it's not 4-1, it's 4-0 with one abstention.
Yep.
Oh, sorry, with one abstention, excuse me. Thank you for that correction.
And that's what Gillian has right here in the minutes. And like I said, Ann, I am happy for you to come in and speak anytime. Just shoot me a message, email, whatever you like, and I'll be happy to sit down and explain to you as much as I know. Sometimes there's a lot of things there's a lot of legacy expenses here that I'm trying to get rid of.
And I'm absolutely learning. I mean, there's a lot of things you know.
Me too. Amazing
yes.
learning curve on this thing.
Yes.
Could I get a copy of the budget so I can enter it into QuickBooks?
Absolutely.
Thank you.
You should be able to access it. It's in QuickBooks.
This is in QuickBooks?
Yeah.
Oh,
You should be, just make sure that you can access it. If you can't, we'll make sure that you're tabbed in if we have to.
thank you.
I appreciate it, everybody. That's better than I thought.
You can sleep tonight.
Well, maybe tomorrow.
Still have work to do.
Always a little bit of work. Sorry, Karen.
No worries. Thank you.
Calls
Thank you
recorded.
guys. Really great work by staff and Gino and Gillian and Dr. Rudy. You guys really did an outstanding job, and Charlie with all of your assistance in getting everything straightened out financially. So I don't know if she's still there or not, but I just wanted to say thank you for all the great work.
She's here.
Yes.
Thank you.
All right. Wonderful. All right, let's kick over to the agency activity reports starting with the health administrator report, because there's more for you to talk about, right, Gino?
It's not much. So we did have a lot of big deposits occur in the last month. So April was a very smiling month in that sense. There's still some 90-day past invoice date big payments. One is $81,000 for the threat prep grant. There's 3 payments of $27,000 each. So we're expecting that to come in this month. And then we have some immunization grant payments that have been billed that are still 90 days past invoice for almost $12,000. So there's still another $94,000 that's past due that we hope will hit the budget or hit the books by the end of this month. That would be really nice. Other than that, there's not much else to say. You know, the new nurse will be great. I can't wait till she starts. Hopefully the middle of June.
Hey, Gino, I have a question for you on that, because you mentioned she'll be sort of sometimes full-time, sometimes part-time. So how does that end up classifying her as an employee,
So
or how does that work out?
We will classify her as a permanent part-time employee to start. And then we will move her to permanent full-time upon completion of her degree when she'll start full-time and working 40 hours.
Gotcha.
So there will be periods of time, but as you know, with the academic calendar, there will be periods of time where she's not in school and she'll want to come in and work full-time and things like that. So those will be periods
Gotcha.
where I'll allow to do so. So, and Dr. Reedy alerted me to a new rule by the state that there's no longer a 1,000 hour limit, annual limit on part-time employees. So she could work more than 1,000 hours as a part-time permanent employee.
Will she be required for time and a half above and beyond the 1,000, or is it
Not
still
at
going to be
all.
at regular rate?
Be regular rate.
Okay.
And not easy to
Right.
find nurses. She came not because of the money. She's coming because she wants to be a part of public health, and she really liked the atmosphere here. So we're trying to build it, and that includes the Board of Health, build an atmosphere that people feel comfortable coming to work and happy, and I think you guys have been able to continue it, so I appreciate that.
You're welcome to come to the movie.
They have jobs.
Oh, that's.
They have jobs.
All
That's it
right.
for that.
That's it. Thanks, Gino. Dr. Reedy with the health officer
There's a
report.
typo
What's
on
that
it.
8 there?
It's incorrect editing by me. There it is.
Okay.
So we can do it screen. So we'll discuss the COVID report next. Next screen. Oh, okay. So in February, March, and April, we saw low numbers. In the last 2 weeks, we've seen increased cases of COVID. Both the reported ones, we're now up to 15 or so new cases a day that are reported, meaning they have a PCR test done. And there are others that are tested at home and are positive. And that's considered good enough. It just doesn't show up in the state statistics, even if the person calls in and lets us know. We are giving advice to people. We're not calling each person. That changed at the state and national level a few months ago. The hospital numbers remain low. There is no increase across the state, a very slight increase. Deaths are remaining low in the state and the county. The number of cases is not going up, is not unexpected, as discussed last month. It happened in Europe and other places. Omicron variant keeps changing, and there's always a newer variant. I can't even keep up with which one's the dominant one in the US, because every few weeks it's changing. And that's typical of coronavirus. Coronavirus is responsible for about 40% of common colds, and unlike influenza, they mutate even more quickly, and that was recognized 2 years ago when this first started, when people were trying to predict the behavior. The current Omicron variations tend to increase the infectivity. And the question of if you have previously been infected or vaccinated, how much protection do you have from the immunity against either acquiring a new infection or having a serious disease? That's the big issue now. We certainly see that there's not great protection from getting infected just because you've been infected or vaccinated before. But so far, it does look like if you have had booster shots, if you're over age 50 or 60, that you're that you will be protected. Other measures of the disease, including the wastewater surveillance, the Charlestown septic sewage system is sending samples weekly, and it remains at a low level as it does throughout the state. The vaccination levels continue. We can not worry about the PowerPoint. We can post that on the website. The vaccination levels have slowly gone up. A little over a year ago, Jefferson County, on the first report of numbers of people vaccinated, was the lowest in the state. According to the West Virginia Department of Health and Human Resources website, Jefferson County is the 12th best as far as the number of people who have residents who have received at least one vaccine. 14th best is complete vaccination. It had been discussed earlier in this meeting about difficulties with data. So here we're talking about census data, and what that does for funding. It's also important when we're trying to look at proportions of people sick. So the denominator, which one do we use? Our denominator keeps going up. Kanawha County and others keeps going down, but which one's used in the calculations is always a question when you're comparing against different databases. The other question becomes, how do you count the numbers of vaccines? If it's relatively easy in theory for us to count how many shots we gave here, but how many were given by the different drugstores and medical practices, and how many were received in hospitals in other jurisdictions, other states. If you receive a shot in the VA, that's a federal institution. If you receive a shot at the National Guard or in Maryland, that won't show up on the West Virginia data. So they have to get data from the CDC for their numbers. If you look at the CDC's website of vaccinations in the county, Jefferson County is the highest vaccinated percentage. And that's great. Doesn't change our need to still vaccinate, especially the more vulnerable getting their boosters. But this in public health is a real problem, is measuring where we are, because there is no single data source. And some of that's inefficiency, and some of it is the problem, people really don't want their data collected, whether it's census or not. So it's a problem we face going forward. As far as the Omicron variant, I don't know which one is going around here. We do not get real-time data, haven't been getting any data lately on which subvariant is affecting Jefferson County. But there's no reason to suspect we're any different than the national data reported by the CDC. But I don't have any others. Sorry. PowerPoint.
Technical difficult. It's just
The computer's just not, it's just not powerful enough to run
It
that.
just froze and then we
Oh,
were ready to
okay.
get out of the meeting.
Yeah, we don't want to end the meeting.
Other aspects of the clinical, we have not really changed in numbers of other situations we're seeing. The activity report for the clinical services, I think, is included.
Yep.
Any questions?
I like listening to you better than the PowerPoint. Very much.
Yes.
It's shorter that way.
Appreciate it.
Any questions? No? All right. Gillian, environmental report.
Okay. So I think Gino sent out the report yesterday or this morning that has the numbers in it, but staff conducted a total of 113 inspections and or evaluations and 8 plan reviews in April. During April, Alex and Lexi also went to Morgantown for a few days to take the CPO course, the Certified Pool Operator course. So they'd be better qualified during the pool openings and inspections. Jen, Lexi, and Alex all completed, it's about an 8 to 10 hour online course for environmental assessment training. The environmental assessments need to be of like a foodborne illness outbreak, and we're going there to collect the data that we would normally collect when there's a foodborne illness outbreak investigation. I also last month attended the West Virginia Association of Sanitarian Conference, which was very good. I did bring back some good information to share. And also the West Virginia Association of Local Health Department meeting last month. So there was a lot of travel going on last month, but they still ended up doing a good amount of inspections, still not enough food inspections right now. But we also had some pool openings and things this month and other that were going on. And of course, they still have a lot of well septic work last month.
I'm curious. You said that there was training in Morgantown?
Yes.
That's a heck of a lot better than having to go to Charleston. Is Morgantown now becoming the center for this kinds of training?
Not really. So the sanitarian training course that they'll be attending is most of those courses they do have to go to Charleston for. There's 1 week I think that they spend in Morgantown and 1 week that they spend in Cedar Rapids. I forget where it is. That's where the subject course is. So Cedar Lake, Cedar.
Okay.
But yeah, they do still spend around 4 weeks time in Charleston.
Yeah, I think that's something that needs that the legislature. I think the time has finally come for the legislature to address issues like that, so that you have. It's fine to have people go down to Charleston, but there should be something somewhere in this side of the state where people can go to. I mean, the Eastern Panhandle is technically 8 counties, so there should be something, even if it's put in like Hardy County or something like that, that's no more than a 2-hour drive. Because having to drive 6 hours or 5.5 hours to Charleston to do these trainings is kind of almost. My 2 cents, I'll get off my soapbox.
Well, we certainly agree with that because they are then not available. We are paying travel time and expense, but they're not available and they're tired afterwards. Hopefully, even more and more things can be by remote access as well.
Yeah, that's a good
And
point.
there has been a lot of movement in the last 2 years towards that.
They did upload things on Blackboard, so some of the training will be available that way, but they're still gonna be gone for in-person training close to 6 weeks of traveling for that. So it is a lot of traveling for training, but a lot of other health departments voted to have more of the trainings in person rather than virtual because they thought it was more beneficial to have the in-person training. And they are trying to revamp the training. It would be nice if they did offer more training locations to kind of spread it out around the state and make it so you don't all have to travel so far.
Dr. Reedy, at our work, we have something that's called Media Lab. So this is like government people, they can, use the program also, you can actually interact. Like you put one chemical to this tube and then what's the next tube, like you can interact. They teach you, like they go through the lecture and then you get to interact on the computer. Yeah, look it up. It's called Media Lab, and see if you can, they can integrate the program into that. The company probably send people out to learn our technique and put it together program. We don't have to go anywhere for our continuing education.
Well, for our continuing education is fine. We can do most of that virtually, but the state, with those state required trainings for sanitarians, that's something that the state will have to change. But we take a lot of virtual courses offered by FDA and APTO, and they've done a wonderful job with their Zoom trainings. They have a lot of breakout room discussions, like the one that I was just in training this week for root cause analysis, which also has to do with foreign illness outbreaks. But that training, they had us go into breakout rooms to do these activities, and then we would come back in and we'd share our screen to show what we had done and discuss that. So it was very interactive and well done.
Yep.
So
Even college do that now too. Yeah. Even for lab.
That's not 21 rabies. Wow.
I think it was.
That seemed like a lot of
I think it
rabies to me.
actually
A lot of rabid animals.
So these are animal bites.
Yeah, it's
21.
not rabies per se. Those are just the animal bites report.
Okay.
Only one was actually set up for testing,
Okay.
and I think that one was negative.
Okay, I was like, 21 rabies?
Yeah, so we should change. the way that
I think that needs to be,
state,
worded
because it's
differently.
not 21.
21
There's
reported bites or
no
something like
rabies
that.
cases. No
Zero, okay,
rabies
thank you.
cases. Zero rabies
Thank you.
cases.
I mean, if I had a dog, I'd be super concerned.
But once you get bites by wild animal, is considered
That's the
part of it, like,
potential, and that's why.
Correct,
people
and that's why you
need it.
you send it out for tests.
I've run into some random people.
And
Indeed.
some of these other bites and encounters, there may not have been an animal, because it could have been a wild animal that wasn't caught, and if that's the case, then they're always recommended to receive post-exposure prophylaxis.
Okay, okay.
Yeah.
Yeah, I'm just looking at that number. I'm like, learning something new every day.
Getting the pets vaccinated against rabies is
Okay.
very important. There definitely are wild animals, including feral cats, who have rabies.
Yeah, I feel like I see a rabbit once a week.
Wow.
Rabies is
Not
pretty much
surprised, though, but-
endemic in this area, so it's here, like in animal, yeah.
I saw a rabbit fox yesterday, so.
Raccoons.
Raccoons
Specialized.
they're one of the, in the US, they're the mammal that carries the most rabies. However, most human exposures with rabid animals are to dog bites, domestic dogs.
Oh, wow.
Yeah. So.
Cujo, fox book.
I was
Yeah,
thinking
like-
back.
Never saw that. It's a great book.
All right. Are we done on the environmental?
Yep.
Okay. Clinical, I guess, do you have anything, Gino, or we're waiting on obviously a nurse to?
The report speaks for itself. We've seen all.
Okay.
We're busier on the clinical side. It's been pretty amazing to see the schedule lately. The word is out. Come see us, please. Trying to, build a reputation and that people want to come here for some of the services that we provide. And I think we're doing a good job of that, making sure we get out to the public, Dr. Reedy and myself, and that's all part of it. And saying, hey, you should come see us. We're good people.
Did you check this vaccination?
Yes,
Can I have one today?
Bring you around and see that you qualify.
Absolutely.
I'm overdue.
That's your insurance policy.
I don't know of anybody that's voluntarily wanted to get a tetanus shot. I've always gotten it because I've had some kind of accident.
It's probably best to be careful.
All right, Mason, threat preparedness.
Yeah, sure. I'll keep it pretty quick. So I attended a virtual tabletop exercise. It was called Smoky Mountains, and it was with Jefferson County Emergency Management, Ransom PD, and a bunch of other partners in the community. It was like a regional wide exercise, and it was a good opportunity to really meet new partners in this community and other communities. Although it was virtual, so it was kind of hard to really interact with the other counties, but that was a part of it. And then I just did a hazards vulnerability assessment, and that was with the healthcare coalition that I'm a part of. It's like 9 counties, all in the Eastern Panhandle. And I think there was a question last time about CERT training. So the person in charge of that is actually getting trained right now and being able to teach the class. So it's going to be a little while. But once he's done with the training, we're looking to start back up the program. I'll keep you updated on that.
Thank you.
And that's it.
Left something out of my administrator report. I apologize. I was mostly focused on budget and other things. So we had discussed the cell phone usage and how people were submitting bills and the reimbursement for their cell phone usage could be up to $70 a month and things like that. So I changed all that. We're now providing a non-taxable stipend that appears on their check. It's $25 and it's only for 8 employees, no management. So unfortunately, Gilling has lost her phone reimbursement, and I never had it in the first place, and neither did Dr. Reedy. So we restricted it to nurses that go out in public, sanitarians, of course, because they go out in public. Our threat prep officer, who is often on travel and still needs to be available and needs to be available after hours sometimes. So we restricted it to those individuals.
And
So
keep in
that,
contact with
right,
Steve Allen.
and the emergency preparedness for Jefferson County. So and we restricted it to those individuals. It's not a huge savings, about $1,000 on per annum, but it's $1,000. And I think it puts us more in line with industry standards, including nonprofit industry standards. So,
Do you ever train for Six Sigma?
so what?
Six Sigma?
No. Oh, Six Sigma. Oh, Six Sigma training. No, I've considered it, but it's not something that I don't know.
Actually can save money. We be able to
Yeah, that didn't that come.
Back our budget and give all the employees.
Yeah, lean management. Yeah. So I think I probably already incorporate a lot of those things without knowing it. But that's the goal. The goal is to try to improve efficiency and make sure that we're working and adhering to what are other nonprofit and healthcare industry standards as best we can and best procedures.
Make sure everything's efficient.
Of course. The German in me says yes. Efficiency.
All right, well, thanks, everybody. Our next meeting is scheduled for June 10th at 9 a.m. Are there any other items we need to discuss before adjourning? And if not, I'd like may I ask?
Could I point something out, Karen? During the first bit of this meeting, I could not hear at all. And something happened around 9:44 that brought everyone into very clear. I can hear everyone great now. I just wanted to point that out. I assume the sound person made some adjustment. And it needs to be it needs to be like it is right now.
Awesome.
Can you update maybe on the internet status?
Yeah.
Okay.
I did update Karen on internet status. So it's still a ways away. Sorry.
Okay,
And
I
the
didn't know if it was
reason
a sound adjustment or a web connectivity
It was a
issue.
sound adjustment. It was coming out of the PC speaker, not through
I see.
the room sound system. That's why.
I see. Okay, well, I just
Great.
wanted to let you know, so for improvement in the future, that's all.
When I have
Thank you,
internet
Nathan.
and real internet information, I'll tell you. Unfortunately, I'm been roped into being the project manager for these two state agencies that we piggyback off of. So here I am.
All right, is there a motion to adjourn?
So moved.
Second.
I second.
All those in favor say aye. Aye.
Aye.
All right, we are adjourned. Thanks, everybody.
Thanks, everybody. Enjoy the
Have a great weekend.
incredible
You
weather
too.
we've been
Safe
receiving
travels.
over the last.
Thank you. I'm finally coming home for a couple days.
Weekends are like
No, that's